Welcome to Healthcare Sucks, the Oregon Governor's Edition. From our fearless leader, Kate Littlebrain Governor Brown. All joking aside, uh, I watched a little. We're going to watch this whole thing together if you're interested. Uh, but what I did pick up on is it's now in the rural areas of Oregon. They haven't came out and told us the truth. They're still hiding the truth, as in many states. So I urge you still to ask these questions if you can make the phone calls, and anybody will answer in your governor's office, your senator's office, or up in the president's office. All debts must be postponed immediately to anyone who is quarantined. Their jobs must be put on hold and kept so they can go back to work when they're better. A card must be issued to the people, tax-free, debt-free, paid for out of federal funding of the 8.3 billion signed by the president yesterday, and what has been allotted to your state. They can cover this, and that's to buy stuff so you don't have to leave your home, etc. So you can have meds delivered, you can have any goods delivered, foods, anything, and so you can survive this. Don't forget to call, guys. I know some of you have been. I'm really proud of you, by the way. I think we're uh, as a team, we're just doing great. And with that, I'm going to jump right in. Let's listen to Fearless Leader and then what they say they're going to do. I'm not too impressed with the whole thing. I don't think anybody out here is impressed with what's going on with the states and the governors. And the further up you go up the chain, it's just the ball's been dropped, and I think that's why Pence is the fall guy again. And I smile when I say it, but that's, I think, what's happening. And I the president has always got in front of the ball on everything, and the reason he's not is this is Wall Street. Wall Street. One more time, Wall Street. All right, here we go.
Thank you and good morning. I appreciate you all being here this early on a Sunday morning. 9 days ago, I announced we had Oregon's first case of COVID-19 coronavirus. Late yesterday evening, we learned of 7 new cases in Oregon, bringing the total number of cases in our state to 14. First, my thoughts and prayers are with these Oregonians and their families. I understand that this news is very concerning. As your governor, I want to reiterate how seriously we are taking this situation. I have consulted with the Oregon Health Authority, and I am declaring a state of emergency to ensure that we are able to swiftly deploy the personnel and resources necessary to address coronavirus in Oregon. This emergency declaration gives the Oregon Health Authority and the Office of Emergency Management all the resources at our state's disposal to stem the spread of this disease. Specifically, it activates Oregon's reserves of emergency volunteer healthcare professionals. This is particularly important because of the cases identified in rural Oregon. It unlocks valuable support to help local public health authorities. Additionally, the declaration grants broad authority to the state public health director, to OHA, and to the Office of Emergency Management to take immediate action and devote all available state resources toward containing this disease. When the first case hit in Oregon, our teams were ready to quickly identify and monitor those impacted. We also investigated others that may have come into contact with the individual. It is through these preparedness and response efforts that health officials are identifying and monitoring new cases. The situation is evolving here in Oregon and, of course, across the entire globe. I understand that it can be scary to hear news of fellow Oregonians coming down with the coronavirus. I have directed the Oregon Health Authority to consistently disclose information on positive cases moving forward, including age ranges statewide and cases by county where individuals with the coronaviruses are located. I can also assure you that local and state health officials are working around the clock to address this crisis. They are trained professionals who are putting your health and safety first. Additionally, I am in constant contact with our congressional delegation and others at the federal level to ensure Oregon is receiving the attention and resources we need from them on this issue. We will do everything in our power to keep Oregonians safe. This state of emergency will remain in effect for 60 days. It can be extended until the public health threat of the virus is contained. With that, I will invite OHA Director Pat Allen to give more specifics about the new cases and to share next steps in our response efforts. Thank you very much. Pat?
Thank you, Governor. Today, what I'd like to do is give you a brief summary of the latest information we know about COVID-19 and tell you how we intend to use the powers under Governor Brown's emergency order to mobilize Oregonians in an unprecedented state and private effort to contain the spread of COVID-19 in Oregon by focusing on specific at-risk populations, protect Oregonians at greatest risk of the most severe outcomes of this disease, older adults, people with underlying conditions, and the homeless and people who are vulnerable in other ways, and respond with fast, targeted, and effective measures to safeguard our state against widespread illness and disruption in the face of a growing outbreak. Yesterday, the Federal Centers for Disease Control and Prevention issued guidance that identified older adults and those with underlying health conditions as being the population at greatest risk. Our strategy is based on the emerging science and the risks identified by our federal partners. As I've been saying throughout, the time to declare an emergency is when we need the tools that an emergency declaration provides to protect Oregonians most at risk. As Governor Brown told you, the COVID-19 outbreak continues to expand in Oregon. Many Oregonians...
Okay, this is my state, so I get to criticize and pick and choose. These bozos came on weeks ago and tamped it down. There's nothing to see here. Since we're on the nothing to see here, I'm supposed to say we use the Fair Use Act officially. And everything you see always, just like these guys and that fake governor, is all an illusion. It's all fake news. It's all fiction. Joking. Yeah, they have dropped the ball and dropped the ball and dropped the ball. And these are the people that I called. Look at my video. Senator Wyden is not on this video, but also Kate Brown's office. They won't answer the phone. They won't answer the questions about when you become ill, are they going to, cancel or not cancel, but at least postpone all debts, keeping our credit rating up, and put a hold on all rents, everything, and issue a card. Are they? Did you hear that? Because I didn't. So let's listen to more hooey in my state. I could definitely speak to, because I've been on this since day one, trying to get answers and questions out of these people, and they've done nothing but ignore. Every email they have received, they have not answered. Which means, like before, when we've had issues with Governor Brown here and her nonsense, she takes it and pushes garbage can in our emails, wads up the paper ones, throws them in the trash can, and thinks she's all-knowing and all-seeing. She's not. And our state officials are messing this up. This is not a joke. If you're watching this, little Kate Brown, which you should be, you should address what we the people are asking you. President, if you're watching this, please address the questions and make sure the funds are there for the people in the debts, or postpone immediately for the people once they go into quarantine. Here we go. Let's hear what they have to say.
Are wondering, will COVID-19 appear in my community? Will it affect my family, friends, and other people I care about? Could I get COVID-19?
Answer's yes.
I understand these worries. Oregon public health experts and healthcare providers are learning more about COVID-19 every day. We're working closely with healthcare providers and local public health officials to test and treat patients, identify people at risk, and keep you informed so you can protect yourself and your loved ones. Help us stem the spread of COVID-19 in our state. What we know. The Oregon Health Authority has confirmed 7 new presumptive cases of novel coronavirus resulting in the disease COVID-19, bringing the state's total number of those who've tested positive to the virus to 14. The 7 new cases are located 1 in Douglas County, 1 in Marion County, and 5 in Washington County. The cases include a mix of community spread and spread related to contact with a previous case. There are no travel cases in these 7 cases.
And that's why it's scary, guys, is because this is not travel related in Oregon and a lot of other places. And because this thing is a bioweapon. Let's not kid ourselves. I've covered it. Go way back. This was engineered to do these kind of things. It was engineered when it's a bioweapon to mutate, to adapt, and to go on. Its goal is to continue spread and continue in its form of living to accomplish the end result, which is, in a lot of cases, to kill you. I'm not going to candy coat it. Bioweapons are to kill you. Bottom line. They don't make one of those, it's not an EMP, guys, where it knocks out the lights and, everything's all, like that kind of situation. It knocks your lights out once and for all. So we'll listen to some more of the hooey and then I'll comment.
Contact investigations have begun to identify and isolate anyone who may have been in close contact with these new cases. Today's news is both troubling and expected. We know COVID-19 is in the United States and in Oregon. COVID-19 is a communicable disease.
And he just gave it away. It was expected. Excuse me. It was expected. Okay, what part of expected weeks ago when I was reaching out and we've been asking questions, and if you go way back, I had these same bozos from the health authority, which are bozos in Oregon. I can truly speak to it. Believe me. I have to fight for them to get everything approved. I have to fight for them to get treatments. Why? Healthcare sucks! Yeah, it does. And so, tamping it down. And this guy's got a runny nose. Do you notice that?
No, it will spread. We know we will see more cases. But we also know there are steps we can take to prevent COVID-19 transmission and protect people most at risk. Older adults, people with underlying medical conditions, people who are homeless or face other barriers to medical care and services. All of us have a role to play at work, at home, and out in the community. By taking effective evidence-based action, we can slow the spread of COVID-19, protect people who are most vulnerable, and deny the virus the opportunity to cause widespread disruption to our daily lives. The Oregon Health Authority continues to take action to fight the spread of COVID-19 in the state. The emergency powers Governor Brown has authorized today will give us more freedom and flexibility to contain the outbreak and protect Oregonians. Here are some specific actions we're taking. We're expanding testing. OHA is finalizing agreements with major hospital systems to expand COVID-19 testing and expand locations where COVID-19 tests can be conducted safely without creating avoidable exposure risks for other patients and the healthcare community. We are prepared to activate volunteers who are trained and licensed medical professionals who can augment services available in local areas, particularly rural communities whose public health resources are stretched thin. We're expanding telemedicine. I'm using my emergency authority to give health systems, insurers, and coordinated care organizations greater flexibility to expand telemedicine in Oregon. Telemedicine is an effective way for healthcare providers to screen, evaluate, and treat patients who may be worried but well, mildly ill or at risk, without coming into a clinic or hospital emergency department and exposing.
The reason I'm laughing is the telemedicine thing is the biggest joke in the world, guys. We've already had that here. It does not work. And how are you going to screen somebody over the phone? Yeah, they can talk by verbally this, verbally that. But that doesn't mean either side is getting the right information and it's being acted by. Oops. Touchy. No touchy, remember? No touchy. No touchy. No touchy. Dr. John Campbell. Check him out. Telemedicine's a big joke. But it's something. We'll see. He mentioned the homeless. Did he mention how we're going to deal with it? Maybe he will later on. We'll see. But I've been on that. You know, we've covered that at Healthcare Sucks. Thank you guys for tuning in and giving your opinions. They're not. Because we are the 99%. One more time. We're Team 99. Remember? Team 99. Team 99. I like that one myself. So if you guys like it as much as me, we'll keep it as Team 99. And we all know to add the percent afterwards. Again, unless you're 1%, you're not equipped for all this. And you don't have access. And they didn't say anything about free care. It should be... we didn't bring this thing here. It's not our problem as far as how it got here. There's no way in God's green earth you, I, or any of your friends brought this here. With that being said, the responsibility is for our government. We pay the taxes, guys. So when things like this, epidemics and things happen, it should not be, you know, and I'm only going to touch on this for a second, but if we can give free health care to everybody from out of our country, we can give free health care to everybody in our country. Can't we now? The other side of the coin, what's fair for the goose is fair for the gander.
Other patients and healthcare workers to potential illness. I'm convening providers who serve older adults and other vulnerable populations to mobilize an aggressive outreach and prevention strategy to protect the people who are most at risk. And finally, more funding. Tomorrow, the legislature will consider an emergency $5 million request for funds to fight COVID-19 in Oregon. We will continue to assess our need for resources to support Oregon's strategy to contain, protect, and respond to the needs of Oregonians who face the greatest risk from COVID-19. Finally, let me say this. In Oregon, we have many strengths and tools to be able to fight the spread of COVID-19. A passionate and well-coordinated public health system, effective and aligned healthcare providers, higher rates of healthcare coverage than most other states, which give 94% of Oregonians the ability to access medical care, paid sick leave laws that give people in Oregon the ability to stay home if they're ill and protect coworkers and others in the community. However, we cannot combat COVID-19 if we turn on each other. COVID-19 does not discriminate. That only puts sick people and the broader community at risk because it discourages people from seeking the help they need, from getting tested, from getting care, and staying at home. We cannot shun and stigmatize people who test positive or become ill. We must join together to take science-based actions that protects those who are most at risk and minimizes unneeded, counterproductive disruption in our community. Now I'd like to turn the podium over to Dr. Dana Harganani, Chief Medical Officer for the Oregon Health Authority. Yeah.
Thank you, Director Allen. I'm Dana Harganani, Dr. Dana Harganani, Chief Medical Officer at the Oregon Health Authority. I'm also a practicing pediatrician and a mother of 3. I know people across Oregon are concerned about COVID-19. Today I want to tell you the latest information we know about the cases Director Allen has mentioned. So what do we know? Yesterday, the Oregon State Public Health Laboratory identified 7 new presumptive positive cases. That brings the total positive cases of COVID-19 to 14 in Oregon. The location of those include 1 case in Douglas County, 1 in Marion County, and 5 are from Washington County. 3 of the cases were hospitalized at the time of diagnosis, and the remaining 4 cases experienced mild illnesses and symptoms that are recovering at home at this time. None of the new 7 cases are related to international travel. 4 of the 5 new cases in Washington County are related to contacts of previous identified cases. The remaining 3 cases are being considered community acquired. So what do we know about the risks of COVID-19 for Oregonians? What we do know is that most people who get COVID-19 are going to experience mild symptoms. We know from data collected nationally and internationally that most people who contact COVID-19 experience symptoms similar to the common cold.
Real quick, as far as the money goes, the president just signed $8.3 billion. Part of that is going to go to the states. So the little drop in the bucket, $5 million, and that's not a drop in the bucket, guys. That's a lot of money, but it's how they implement it, where it goes, and what they do with it. How much of it goes to crappy organizations like Samaritan that could give a damn less, that pay out huge golden balloons to all their senior upper crust workers. You know who I'm talking about. And this is one of the opiate farce ladies, opiate farce queens, that lead the opiate farce about all the lies about the opiate. I'm not going to go into that right now. We'll talk about the opiate farce later on, but it is, and I've proven it. Go back and watch my videos, guys, if you doubt. So with that and other things we've dealt with these people on in Oregon, I don't care if she says she's got a little practice and she's got 3 kids. It's just so heartwarming for me. It's not. Because deep down, she's one of the queens of evil of Oregon's health plan and Oregon's health care. She has actually caused problems for seniors and disability people getting things, getting items, getting coverage in Oregon, to where we have to fight. And then a lot of people that can't fight still get turned down and don't get the items they need. Stockings for blood clots. It's a necessity. Other items that when a doctor writes that you need it. That's why we'll talk about healthcare changes in the future too. So let's watch this and then we'll keep on track.
Off a runny nose. This week, the Center for Disease Control identified a set of population who are going to be more at risk. Those include older adults, people who have severe and chronic medical conditions like heart, lung, or kidney disease. We also see from the earliest data that those older people are twice as likely to have more severe disease than others.
And she's saying the complications and the signs are looking more like a common cold. Part of it is a little bit of that common cold, the cough, the dry cough, and etc. But then you guys can go through Dr. John's stuff. There's a whole list of, like, at a point fever. You can even have loose bowels, diarrhea, etc. Again, there's a list. And she touched on it's like a common cold and you threw it aside. That's what I'm saying. These bozos in Oregon are unprofessional. And if you think they're professional, wait until you need them. That's what I'm going to say about that.
So how can older adults and people with underlying chronic medical conditions stay safe and healthy? First, the recommendations are to minimize contact with people who may be ill and try to avoid large public gatherings. Ensure that you have prescriptions at home to last you for a while. Consider mail order.
Oh no. Whoa. Sorry, this is where healthcare sucks comes into the picture. This is one of my pet peeves. A doctor writes for 90 days. The damn insurance company pays for 90 days. No, it don't. I just went to try to get my stuff, a 90-day stuff. No, they will not. She will not authorize it. That was bull. It's starting to get the flat out lies, guys. Hey, that was a poet one. Anyway, serious. At this time of need, definitely, they should cover 90 days anyway. But they could waive it right now no matter what with this emergency act. You heard that the wonderful Governess signed, our fearless leader, that we're in that mode. I wait to read that. When I can get my hands on that and the details, I will tell you it's partially unnerving. It's going to be very unnerving to some after seeing. Go back and watch the report from BP about locking down communities without any notice in California. Look for them to be just popping in your neighborhood and blocking streets and locking up things. And this is not fear porn, guys. This is reality porn. Again, this is the state I live in. This is my backyard. So I can speak to a lot of other backyards, and I still know what I'm talking about. But this backyard, this is where the dog lives. The dog barks here. The dog goes to the bathroom in this backyard. The dog knows this backyard. And I'm telling you right now, not that other places have police out of control. Marion County is one of the most worst, out of control police forces there is. Secondary only to Polk County. The Polk County good old boy Dukes of Hazzard pukes. Not kidding. Polk County is the suckiest. And this goes to all you judges out there. You suck. Yeah, we know what you've been doing in the past. There was one good judge out there at that time. And his name was not Lukeman. Lukeman was a pukeman. Yeah, period. Anyway, enough of that. We could talk all day about corruption and how they keep people in jails to make money, and the judges who own stocks in the jail. Anyway, it's dirty. We're not going to go into that. We're going to talk about healthcare today.
You need to take common daily precautions. Wash your hands frequently. Don't touch your face and eyes, and clean surfaces. As Dr. Allen mentioned, we're focusing on our testing capability. The Oregon State Public Health Laboratory is beginning to run low on certain components, but we are looking at resupplies from the CDC and working with our state partners to the north. Also, as Dr. Allen noted, we are working with hospitals to bring more testing capacity online as soon as possible. We know we can all work together to reduce the spread of COVID-19 in Oregon and continue to protect the most at risk. Thank you.
Yeah, we could work together, huh? Team 99. We could work together if they'd answer the phone. Am I right? I'm right.
Hello, I'm Dr. Bob Dannenhofer. I'm the Public Health Officer from Douglas County. Douglas County, last week, we had a single presumptive case of COVID-19 in Douglas County. I'm pleased to report that the patient is medically stable. Thank you.
Good morning, my name is Katrina Rothenberger. I'm the Public Health Division Director for Marion County Health and Human Services. Marion County has
more evil
positive of the novel coronavirus, COVID-19. Our thoughts are with the affected individual and family. The health and well-being of Marion County residents is our #1 priority as we respond to the needs of our community.
They never has been in the past.
Through the weekend to identify close contacts to the individual. The Marion County case had no previous contact with other confirmed cases and is suspected of being community acquired. Most people with COVID-19 have mild symptoms. If you're feeling sick with mild symptoms and do not need to seek medical care, stay home while you recover. If you are sick and plan to seek care, please call before going in for care so arrangements can be made to prevent exposing others.
Hello everyone, my name is Dr. Christina Baumann. I am the health officer for Washington County. As you heard, Washington County has 5 new presumptive cases of COVID-19 illness. 4 individuals were identified through the public health investigation. The 5th does not appear to be related. Washington County continues our work to identify close contacts to these new cases. I want to underline the point made by our colleagues that COVID-19 can present as a mild illness. We want people to take this seriously and take measures to protect those that are most vulnerable. So we ask you, if you have any illness symptoms, please do not visit people in hospitals. Please do not visit your loved ones in long-term care facilities. Protect those who have chronic medical illnesses and who are older. We thank you for participating, helping, caring, and we will continue to work as public health to do what we can, and we ask you to also please do what you can. Thank you.
Really?
Yeah, thanks. The question was, can we provide the age ranges? We'll be providing the age ranges as part of the tabular information that we'll release, that we update to the website, which should be shortly if it hasn't already occurred.
And with that, as we put it, healthcare sucks and Team 99. I urge you to pick the phone up and see if you can get through to these people and propose the questions that I've proposed in this video again and see if we can get any results, any questions answered. There was a couple good things. I want to give good where good. I mean, if they followed through and this and that. But as you heard, they're out of stuff to make the kits. And they haven't been making the kits. And they haven't been testing. Which means it's running wild. Now it's on our front door. I live an hour away from Salem. 1 hour. Tell me how many people have come through my area that from over there. Well, I can tell you, being the weekend, we get lots of people coming where I live. And so that cop the other day in the aisle could have been from Marion County that I talked about. Is it in Lincoln City? There's a damn good chance it could be. And then you know what? There's a damn good chance it's in a neighborhood near you. And they're tamping it down.